So, hi everyone, my name is Gaurav Bakshi, and I bring you today to the next edition of Strat-Chat, our endeavor to bring you up close and personal with business and HR leaders. Today, we're going to talk to you about something which I think everybody's been talking about, especially in the context of the recent times. And possibly you've guessed it right, it's health and wellness. And it is something that both individually as well as from an organizational standpoint has been at the fore of our conversations and our attention. And we thought, who better than a health and wellness expert to come in and speak with us today? So I'm delighted to bring you up close and personal with Dr. Karan Thakur today. He's the Vice President Operations and Public Affairs at Indraprasth Apollo Hospitals. Somebody who's been a thought leader in the space, somebody who's been a policy advocate, somebody who's seen health and wellness very closely over 15 years now, and somebody who has a deep interest in the area of human resource and corporate wellness. So, welcome, Dr. Karan. It's a true pleasure to have you join us today. Welcome to this episode.
Thank you, Gaurav. Thank you for having me. It's a pleasure. And it's wonderful to interact and spread the message of both healthcare, corporate wellness, and newer things that we all can do through new ideas that can generate through, talks like these.
Pleasure is all ours. And I hope our viewers will take home a lot of motivation because you guys have been in the thick of things. Not only as an organization, but somebody who's really leading the fort when it comes to this entire pandemic and uh, the entire way in which wellness has been shaping up for the corporate world and India in particular. Because from a point of adoption, I think India had a large, long way to go, and suddenly everything's changed gears. So, jumping in straight on, Dr. Karan, my first question to you is around the fact that in your view, you've seen wellness evolve over a decade and beyond. Um, and when you compare today the scenario as compared to the earlier years when you started, and how have you seen this whole thing emerge, and what in your view are the top 2 or 3 trends that are here to stay, and that could be something that every organization especially needs to be very cognizant of. Love to get your views
Right.
started on this, and then we will go deeper.
Absolutely. So, as you rightly mentioned, a decade is a long time for organizational behavior to be studied and analyzed. And there are lots of attributes towards what changes organizational behavior, wellness of its employees, and the relationship between employees and their employer. And initially, I can speak within healthcare in more specificity. One noticed that a lot of the organizational behavior thoughts and theories that were in vogue through management sciences across fields were being put and adopted into healthcare as a whole. And one would see a lot of engagement happening through HR departments, through HODs, and through other managers on how to keep the staff motivated, on teamwork, on team building, on looking at efficiencies and drawing good outputs through those efficiencies, looking at process improvement, looking at bringing in processes that reduce the redundancies, whether it was through the Six Sigma approach or through reducing error approach and things like that. So what one saw in the manufacturing industry, the Toyota way and the Honda way being adopted in toto in pure services and frontline services like healthcare as well. And that did us very well and put us in good stead for the past decade because it brought the workforce up to a certain level of expectancy to deliver on the goods and to deliver on the services that your customer, or in healthcare, your consumer, who's the patient and their families, expect out of you. And also it helped mark a clear benchmarking for the healthcare industry as to what is expected out of a healthcare frontline worker. Now, if you see within healthcare, the approach has mostly been towards a paternalistic attitude towards your consumer. If you think about all the old movies that one would see, you would see a doctor in a white lab coat who's giving bad news or telling the patient to do this or that, or usually telling them that, there is not much hope or things like that. Now, that narrative is something that has become ingrained into healthcare workers, where we are the knowledge holders and we give that knowledge to the patient or the consumer or the families, and therefore the relationship was very skewed. But over the past 10 years, the relationship has greatly changed, some for the good, some for the bad. One, the advent of information boom that one is seeing, either it is through the internet or through social media, you have a lot more informed consumers and customers who are now seeking out healthcare. There are a lot of people who are exposed to other systems, other healthcare systems, whether it is good public systems like the NHS or even very advanced systems of the West like the American system. And therefore, their expectations out of the doctor, the nurse, the healthcare worker, the administrator has changed and evolved over time. Gone are the days when we could very easily just tell the patient what to do or tell the patient what to expect. Today, they are very much part of this exercise of the continuum of treatment. So our attitudes have changed and have had to change because of the changing consumer behavior. And mind you, also what has happened is, even though large institutions like the Apollos, the Fortises, the Maxes of the world have created this large infrastructure, more and more focus has also been on the service excellence aspect of our services. And therefore, the need to train our manpower, to train our workforce and our team members in a way that they understand that the consumer is now looking at clinical excellence as a given. That they have come for already. But they're looking for that extra, the X factor, the alpha, the delta that is expected out of a healthcare worker. And those are mostly more touchy and feely things, which a lot of HR managers and operations managers have a tough time dealing with. Empathy, sympathy, how do you relate to the customer and consumer? And at the same time, how do you manage stress? How do you manage burnout? How do you manage midlife crisis or quarter life crisis, as the case may be, especially in a very young workforce? Add to that is a third layer of complexity in healthcare, is that you have very different layers of specialization that you have, whether it is janitorial staff and right up to a super specialist. They have very different expectations, both out of the employer and also out of how the consumer behaves or treats them. So it has been a learning curve to create those types of programs and engagements that can meet all these requirements. So the 2-3 things that are a big takeout is that employee wellness is going to determine how well the customer is ultimately treated. Because if that does not happen, you will see the end result not being favorable. The second is we've got to move on from teamwork, team building, confidence building to more a relationship where, trust, empathy, sympathy, these are things that are discussed. Thirdly, the pandemic has taught us that what happens at the home can affect what happens to an employee at the workplace as well. So it's unfair to now expect that once you're in your uniform and you've clocked in at 9 a.m., you're going to be a different person, because your home life may be very different now, whether it is children staying at home because schools are closed or a loved one falling sick. That has a bearing on how your employee is going to behave at the workplace. So we've got to look at a newer paradigm that moves more from what we have done in the past 10 years as a good foundation, but now dwells on the more holistic aspect of the individual and how they relate with the institution.
I think fantastic points made by you, Dr. Karan, there, and I think it so much resonates. The entire conversation that you're bringing to the table in terms of relationship, in terms of work-life integration, in terms of the whole consumerization of everything around us. And I think taking a cue from that, when you talked about the whole consumerization aspect, for a long time now, organizations have suffered to give, or rather have strived to give employees an experience which they would otherwise have in their personal life. So when they are maybe ordering through a Zomato or an Amazon in their personal life, and when they are on the receiving end from an organizational point of view, a lot of times the organizational infrastructure and systems haven't really evolved as much to be able to consumerize the experience as much, and possibly add that much of individualized feeling, even when it's an app or it's a simple technology or a simple web interface that they would go through as the first touch point. And I think more so in the space of wellness, because that's exactly a time and a moment when somebody is looking for that extra dose of empathy and sympathy, as you said. And it has to clearly move beyond the transactional aspect of fulfilling that employees need. So beautiful point made there, which actually now brings me to the fact that a lot of times we see that even when organizations have been trying to do a lot for their employees, uh, we've seen the uptake of some of these programs not be as high. Any views on this? Largely, I mean, the largest of organizations, the biggest of spends, a big commitment to employee health and wellness. But we see that other than the pandemic times, of course, the pandemic times have seen a certain upsurge when it comes to the employee appetite for consuming what organizations can offer. But otherwise, there has been a large struggle, and we've seen negligible rates of utilization of any framework. So, your views on that, please.
That's a very important point that you've raised. I think in many organizations there may be an initiative fatigue, where every quarter, every month, we're trying to introduce something new just because it has worked in another institution or a sector or an industry. And there are case studies that flood our inboxes or our reading lists, and we try to adopt them in toto in our setting. But I think first, managers will need to really look within their organizations at what level of maturity their organization is at, both in terms of their own maturity as an organization, as an industry, and also the type of employees that it is dealing with. Now, something which works in the knowledge industry, like an Infosys or a TCS or a software company, may not be adaptable to a tire plant or a rubber manufacturing unit, because their workforce might be very different. So I would caution us adopting anything that emerges as the new flavor of the month, and a lot more work needs to be done to really understand where your organization is and how you can use the best examples from the world, but then distill what works for you. The second, I think, trend that one notices is that generally, with the advent of social media and the other mediums that one comes across, the attention spans for both employees as human beings has reduced greatly. Where we are supposed to convey our inner feelings in 140 characters on Twitter, to expect that you can have weeks or months long training and continue to draw the attention of all employees is needing a paradigm shift and a change. So I think we need to now tailor make programs not for millennials, but actually for the generation Z, which is now coming into the workforce. And I think their motivations are far different from what one saw for the millennial workforce. So what worked for the millennial workforce in terms of training modules, offsites, and other means of engagement, including of wellness programs, will need to probably make a more gradual shift to be more relevant in the TikTok era, if you can call it that.
Yep, absolutely with you. And I think every generation is different. And, I really like the point you made from 140 characters to, now really expecting digital to do everything really. And also the fact around the context. And I think a lot of times we as HR leaders try and adapt everything which is best outside versus completely laying the foundation of what can be built around our own needs and expectations, in a very very sequential manner, so that the absorption is there. So I think from a design standpoint, completely with you on that. uh, I'd like to now also know from you, Dr. Karan, a little about uh, how have you as an organization, and maybe your colleagues, and you've been in the thick of all the action. I think we still I know as we are speaking, you are sitting out there in the hospital, in your room there, and maybe you have been going regularly ever since a long time. This pandemic hit us, and as you can see, I'm still sitting out here on my in my drawing room at home and having this conversation far more easily with you. And still, when we feel like love to come and visit you, we still have to think twice that is it the right time when I can go and meet Dr. Karan right away, or should we wait for the pandemic to get better? And I'm sure you have thousands of people having these fears in their mind, and their families having these fears in their mind. And I'm sure it's not just battling that fear every morning, but delivering your best on a day-to-day basis, as well as giving that faith and confidence to all the people who are you know all the patients in the hospital, and their attendants, and so on and so forth. Love to know more about your views on how have you seen the current times, and how have you emerged stronger. Any one or two examples which you think could be helpful for organizations to leverage this on, because as we speak, a lot of organizations yet are struggling with their ability to bring back employees to work, and there is a large degree of fear there. So what's your take on this?
Right. I think the healthcare worker has done incredibly well over the past 2 years, 1.5 years to be exact, across the world. And I think they've set a good example for their profession and for other professionals to follow. But to do that, as you rightly said, there are some key ingredients that are required to be in place. I think the confidence that the processes are strong, the processes are ironclad, and they help to protect while provide access to your consumer, the patient in this case, was very important. If our staff did not feel secure about our processes, then one would have had a situation where they would have been skeptical to probably even show up to work. So I think every organization, as they are now in the unlock phase and wanting to get back their employees into the office or in through hybrid modes, they have to have a very strong, robust a process book in place to show how we are securing you. And this goes just beyond sanitization or social distancing. I think it goes into the entire process flow of how employees and their interaction with the consumer is taken. So I think it needs to be broken down to every little granular level. For example, we at Apollo, we created what is called the Red Book. The Red Book is a ready reckoner which is now in use across our 70 hospitals, which lays down exactly what you're supposed to do in case an employee turns up and has got a fever. So what is the process flow for them to go into a staff clinic, and then what testing to be done, and if treatment required, what to be done. So there's that entire workflow in place. What to do in case of somebody not showing up and they're having trouble at home. So how can we support them at home? And what are the processes within the hospital in terms of our infectious wards, our non-infectious wards, stratification of risks as per the area, as per the specialty. So all of those were formulated into what we call the Red Book. It's a pretty thick manual on what you need to do, and it's a good ready reckoner that both managers and down the line staff can use. Second, we were very liberal with our training modules. We made sure that all our staff was briefed before every shift to re-emphasize the point on how severe COVID-19 is, how quickly it can spread, what are the risks that you can undertake while you're doing this duty, so that it's very clear in terms of what is it that is expected out of them and what they should expect out of the organization. So training was very important, and this is not just for doctors and nurses. It went down right to the security staff, because they are the people who are physically manning the COVID and the non-COVID interface that is happening. So that is the third important aspect that we did. And fourth was to support our employees through a host of resources, whether it is pick up and drop facilities, whether it is meal services to be delivered in their hostels or at home. Because of the lockdown, they didn't have access to many of the services that they would have otherwise. Also offering them services to stay within the hospital so that they don't have to commute. was offered to nurses and to others. At a more programmatic level, we also introduced, and this was prior to the pandemic, but it held us in good stead, was what we call the second victim program. And this was really thought of and conceived of as an important aspect for healthcare workers. They are usually dealing with situations where there could be a lost life, there could be somebody not coming back, there could be somebody that you see for the last time alive, and maybe even their relatives don't get to see that person in that situation. And that puts an incredible stress, emotional stress, mental trauma on the healthcare workforce. Mind you, our average age of the nurse is between 23 to 27 years of age. The average junior medical staff doctor who's on in the wards doing his duties or her duties is between 28 to 30. These are young people who are being exposed to incredible amount of human psychological trauma. And what could happen is that later they might think of themselves as having caused the output or the outcome. Could I have done something better to make sure that this person would have been in lesser pain or could have even survived? And they start thinking of themselves as the reason or cause, and they become the second victim of an existing tragedy that has happened. So we formulated this strategy where every employee was to report on a team member if they found them to be emotionally stressed or traumatized by any experience, and report it to their senior, and then sit them down with a psychologist or with their own peers or with seniors who could help them, guide them, and at least contextualize the occurrence, and also share experiences of how they have also undergone a similar experience. Let it know that while it may not be normal, but it is something that is very much part of what we do in healthcare. So I think the second victim program is one example of where we can really extend beyond just the roles and duties that an employer and employee need to engage in, and understand the employee as also a human being who might have experienced something which might change them or alter them, and how best can we make them more resilient, make them more appreciative of what has happened, and hopefully overcome that situation. These are a few examples of what we did as an organization, and more specifically in terms of how employees manage that stress as it unfolded during COVID-19 and otherwise in healthcare.
Fantastic. I mean, extremely well-rounded. I think it's not a singular approach which could have worked, and I think all the points that you've made uh, seem to really cover almost every challenge that an individual would have faced while coming to work. Uh, I particularly have seen a lot of organizations do a lot of support initiatives, and also I've seen a lot of organization create their own red books, like you mentioned, in terms of the process. But I still feel that a lot of organizations would not have the know-how which the likes of your organization would have. uh, how do you suggest they leverage this know-how? Because knowing the disease so well, and setting protocols around it. I mean, the two or three things people and organizations have known is about sanitization, it's about wearing masks, and it's about keeping safe distance. But beyond this, we've seen is not a lot of deeper information flow in terms of how to avoid contacting the virus, or how to build safer workplaces, or how to respond to situations. Um, so we've seen the resilience part being taken care by organizations. We've seen the basic part. But if an organization wants to go a little deeper, how do you suggest they approach it? Are there institutions like yours which also help these organizations set out programs which would be a little more scientific in attending to such situations, or something else that you may recommend for them?
Yes, I think that's an important point. It's very important, the triad that you mentioned of social distancing, masking, sanitization. These are all very important. We cannot take away the importance of those. Those are the bench. They're the bedrock of yeah, our fight against COVID-19, no doubt. But I think a lot more needs to be done, as you said, and I think that's where organizations like yours can also play a catalyst role, because there is only so much that an organization can do as they're planning to bring back their services, their operations, probably their manufacturing capabilities or logistics, get the staff back, and also make sure that things are running as per the requirements of their business. But it's for catalysts like probably your organization that can connect institutions like ours and co-create programs for those institutions, which could be a balance of a few things, which is your infrastructural safety, whether we have got the right HVAC in place, whether we've got the right filtration in place, whether our processes are safe, whether we're adhering to those protocols which are mandated by or as per best practices on the infrastructure side, on how do we look at optimum staffing levels. Whereas I could walk into an office and say, well, only have 50% of the staff here. I think experts like you can help HR managers and corporate leadership in organizations tell them, well, if that's what the medical experts are saying, why don't you look at this sort of staffing levels or things like that. And then third is, I think, a lot of training that needs to be done. And this is true. When we have an outside expert coming in and giving a talk or demonstrating what needs to be done and what not to be done, it resonates more with staff rather than your own employee or your own training departments doing so. So I think the involvement, and again, I think COVID has proven that the more we collaborate, the better we can fight this, because COVID anywhere is COVID everywhere, as we know now. So it's not only about one institution creating moats around their physical infrastructure, keeping their staff safe, but it's actually about the weakest link, which could be one employee who goes back home and picks it up and brings it into the organization. So I think a lot more collaboration that brings previously probably institutions that didn't work together on the same platform, create modules. We've done that for a few institutions very successfully also. We've done that for a few public institutions. We've done that for a few monuments where they had issues with how do they manage traffic, what should be open, what should be not. But then I think it needs a relevant via media, people like you who understand the insides of organizations, what can be done, what can't be done, rather than purely relying on the medical clinical expertise only, or trying to do this in-house.
Absolutely. No, happy to do so, and I'm sure, we haven't really thought about it in as many terms as you pointed it out, but I think there has to be collaboration and possibly a catalyst to bring the organizations and the healthcare industry on a common platform to help them both leverage each other better. And I'm sure, captive infrastructure can't solve this problem as well as the collective. So with you on that, one of the things, Dr. Karan, which we've seen uh, cut across is the advent of the virtual medium. And that's where we've seen really uh, virtual capability come to use and rescue like never before. And what is your view in terms of, there has been a lot of, I would say, over the last 1 decade or so, we have seen telemedicine emerge and fail. We have seen a lot of organizations in the healthcare space try and achieve that. We've seen home delivery apps on the medical side struggle to exist and make their ends meet. And now suddenly, the amount of traffic they are getting and the amount of infrastructure needs have really taken off like never before. But what is your view? Do you see it as something which is going to change life forever, and these consumer behavior patterns stick around? Or do you think there will be a certain level of balance which will go back in the favor of the offline, and virtual will exist better than earlier, but not perhaps as much as it is right now. So what's your take? And I ask this also on the context of on the from the side of organizations who are investing with medical partners who could offer virtual facilities to employees.
Yeah. That's an excellent question. So you're quite right that there have been fits and starts in this technology journey that healthcare institutions, both on the consumer side and on the internal processes side, have tried with mixed results. So we've had examples of offshore teleradiology being very successful, where US hospitals are getting radiologists in India to look at X-rays and CT scans and report back. Whereas we've not been able to master simple things like telemedicine, where a chat like this could be a medical consult. And suddenly we see that a disruptive event like COVID comes in, and suddenly the adoption rates, both from the clinicians and from the patients, towards acceptability of this as a medium of reliability, suddenly goes up multiple notches. But I'd like to, before I answer that question, go back a little in terms of how I see it while my work and what it has taught me during COVID-19. We were working in the hospital. We were coming in every day into the hospital because that's the only way we could deliver our services. We could not do, all of us could not do that remotely. But while we were within the hospital, we were still meeting on Teams or on Zoom or on other platforms. So it was not one replacing the other, but one actually strengthening the other. So I came to the office, but I reduced my exposure by not actually physically meeting people just because I'm in office. So I still relied on this technology while being in the workplace and yet being remote. So that might be a new hybrid, because that led to quicker meetings being organized, quicker decisions being taken, the safety being maintained, and us all then going about our own ways and not bringing risks to the table, literally, if we were meeting in our previous meeting rooms or through physical contact. So maybe this is a starting point of how we do a hybrid model where we are at our workplace, but need not necessarily have to be together, to collaborate, to do projects or to execute works. In terms of technology adoption in the healthcare domain, I have to accept the fact that there was a lot of wariness from clinicians themselves in adoption of telemedicine. It was not something that relates to age, that older clinicians didn't prefer it while younger did. It was age agnostic. But now, when it became a situation of either this or nothing else, we see that clinicians are also now adopting this, both for their own safety and in terms of continuity of care. And we find patients also more accepting of this. Now, this opens up new vistas for healthcare access. In a country which is bereft of medical experts, of healthcare infrastructure, this type of reach that is now both enabled by technology platforms and also a willing consumer and a willing dispenser of medical advice, I think it's a great coming together. Earlier, about 40% of patients of Apollo Delhi come from outside of Delhi. They would commute to Delhi, they would come with relatives, they would have to stay here, get their consult done even before treatment was started. A huge amount of resources was spent on getting access to care. If I can now get that at the click of a button without spending anything except my time or paying through online modes, I think that's a more efficient way, which doctors are also more receptive about. So some of these technology changes in terms of medical access is here to stay. Some of the delivery of items to the home had picked up pace. I think retail pharmacies were moving more and more of their businesses online. And today we are seeing online platforms as being in vogue in terms of how consumers also interact with them. The other problem was, much like banks, where you had to go to a bank to get your passbook updated. We always used to hear our grandparents always talking about, I'm going to the bank twice or thrice a week. And as a kid, I used to always wonder what is it that happens in the bank, because they used to go there so often. And none of us go to the bank anymore. I mean, we don't even know which is our branch actually, because everything happens online, happens on the phone. And this is for some a key resource like your savings and your money and your resources. And similarly, I think there is a lot more acceptance now of online consultations. Earlier, you had to come back to the hospital to give your samples. You had to come back to have access to your reports to pick up your physical reports. And all of that has changed now. All of that is available on your smartphone, online, things like that. So I think there has been a lot of catching up that the healthcare sector has also done with a recipient consumer who's also more accepting of this and more believing of this. Mind you, this will not change for some specialties where it is going to be important for you to come and seek your care. If there are patients of, say, you break a bone, you still need to come to the ER. If you need to prepare for surgery, your doctor will still need to see you before you get admitted. So it will not be a one size fits all, even within the specialties of healthcare. But I think a lot more will move online, and that's a good thing.
Absolutely. I think I really like the point you made around the complementarity of technology, and uh, I think that's the right balance that in terms of leverage. I know time is of essence, but I still have a couple of questions left. So one of the big questions, we little bit touched about it when you talked about the second victim program, which has to do with the whole mental wellness piece and how people tend to victimize themselves. But I'd like to extend this a little bit, mental wellness conversation a little further in terms of your view on how you're seeing mental wellness, maybe shedding the taboo, and a lot of stress related or uh, work related, especially. I mean, what's your experience on uh, the usual corporate wellness from a stress point of view, and what kind of takers have you seen? How do you see the market evolve there, and any special things that institutions like yours have in the anvil or already as a part of your kitty to look at that?
Yes, so I think up till now on corporate wellness, a lot of institutions, organizations that were reaching out to us was with employee issues where they wanted something to be removed from an employee behavior or employee habit standpoint. It was de-addiction, it was productivity, it was about how do we get them to be on time, punctuality. I mean, that was the approach towards how do we make our staff more efficient. And increasingly now we find things to add on to their skill sets in terms of corporate wellness. How can they be more at peace with themselves? How can they find their own spot in the organization? How can they feel more content? And these are not wishy-washy ideas of the philosophical nature. It is very much in the corporate domain of people wanting to get ahead quickly, people wanting to be the next big thing, and how do you temper that within the pace and speed of the organization, as it were. And we find increasingly people coming to us with a lot more requirements that they have on inner wellness, on how people can work on themselves to become more productive. And it seems to move away from just how do you become a better team player to how do you become a better player. So I think that has been a subtle shift that one is noticing. And some of our programs now, both by our clinical psychologists and in some cases our psychiatrists, are developing now for this new changed arc of requirements. And I think some of it will also need to be modified as we go along, because working from home, being a parent at home while also being a worker at home, brings its own challenges. How do you basically break the ice when you're meeting somebody for the first time online? How do you make yourself, more relevant in more of these now online world of, social interactions? And everybody does not have that skill set. So I think a lot of development of those skills will also come in the whole corporate wellness paradigm. And of course, the wellness aspects of reducing stress, getting you to break bad habits, leading more healthier lives. All of that will also continue. So there are three streams: one old, one emerging, and one probably in the future that might develop. Is how I see it.
Fantastic. My last question. What's the one big message that you wish to give to organizations out there on the subject of employee well-being? And what's your one big advice for them?
Um, it may be a cliche to say that you're as strong as your weakest employee, but the fact is that a strong workforce can really see you through the challenges that can knock off a business off its skelter. And the one reason why Apollo today, very proudly, we've stood together, we've delivered on the goods, and we've seen two waves come and go, is because we've felt and we know the importance of the employee being sacrosanct to the entire value of the business itself. If the nurse is not there, the business does not exist. If the doctor is not there, there is no need to come here in the morning and open the shutters. So it really ultimately boils down to the fact that your business, the value of the business is dependent on the employee. And that does not mean you transfer all the weight of responsibilities to them. As managers, we need to understand the responsibility of that employee and what they bring to the table. The other big aspect is going to be how you value your employee in the entire value chain. Previously, very honestly, for us, our focus was bring in the best doctors, to bring in the best clinical leadership to lead programs here. But during COVID-19, that housekeeping boy, that janitor who made sure that infection control protocols were being adhered to, was the reason why the business sort of existed. Otherwise, we would have had a huge outbreak, and probably our clinical leadership would have been down with the disease. It led to the importance of understanding that each person has a role to play. So when we look at our employee base, I think we need to now stratify them differently, and the importance that we give to one or the other needs a real relook. And I think that's one way of creating the business for the future.
Really love this point, about with the example that you mentioned in terms of possibly having a different lens to look at what value people bring on the table, not just in terms of the position or the status that they carry, but in terms of who really makes a difference to your customer the most, and how can they continue to keep the hygiene up for your organization. So some really brilliant points, Dr. Karan. I really have loved this conversation, and I'm sure some of our viewers will take home a very holistic understanding on the perspectives around wellness. And thank you so much for being with us. It's been a real pleasure having you.
Thank you for having me. This has been really illuminating. Thank you.
Thanks, Dr. Karan.